Welcome to Pregnancy and Birth Diaries. So, what is a geriatric pregnancy? When I heard that term for the first time, I thought it was some sort of a medical condition, but it turns out it's just a pregnancy that happens after the age of 35. But why exactly there's a term for that? First of all, let's address the term geriatric itself. Nowadays, it is considered a bit insensitive and not so proper to say geriatric as it suggests elderly age. So instead, a term advanced maternal age is recommended. But to be honest, now if I was pregnant, I would prefer it to be called geriatric than advanced medical age. But then I guess it's just a personal preference issue. Okay. So, there are several unique aspects related to pregnancies at later age, and that is why there's a distinction made for pregnancies before and after 35, calling them advanced maternal age or geriatric. Of course, one of the main aspects is health conditions that become more prevalent with age, like diabetes or hypertension, that might impact pregnancy and require careful management. But today we are going to focus on egg quality and egg quantity. We all know that fertility gradually decreases as we age, meaning that there is a reduced number of eggs available and potential issues with egg quality, making it more challenging to conceive. To break it down, let's talk about quantity first. We women are born with a fixed number of eggs, which is called ovarian reserve. By the time we reach puberty, we have a reserve of around 300,000 to 400,000 eggs. Each menstrual cycle, a number of eggs start the maturation process, but only one will usually reach full maturation and will be released into the fallopian tube during ovulation. The rest of the eggs that started the maturation process will be absorbed by our body. Over time, this process of ovulation continues usually every month until the reserve of eggs declines significantly and leads to a very low number of viable eggs available for ovulation each month. So this decline accelerates as a woman approaches her mid-30s. The low amount of eggs in the ovaries is closely related to menopause. Once the ovarian reserve becomes extremely low, there are very few eggs left for ovulation, and hormone levels such as estrogen decline significantly, and this depletion of eggs and hormone fluctuations usually lead to the onset of menopause. Now let's talk about egg quality. Egg quality means the viability and health of our eggs. As we age, quality usually also decreases, but let's first understand what is meant by good quality and healthy eggs. Healthy eggs have a better chance of being fertilized because they have optimal genetic material and are more likely to have the correct number of chromosomes, which increases the likelihood of successful fertilization. And after fertilization, a higher chance of developing into healthy embryos. These embryos have a better chance of progressing through the stages of early development without chromosomal abnormalities or developmental issues. And also healthy embryos derived from good quality eggs are more likely to implant successfully in the uterus. This is crucial for the establishment of a pregnancy. So our body is designed to detect unhealthy eggs and prevent fertilization, but they might still get fertilized, but then they are less likely to result in a successful pregnancy, because if fertilization still happens with an unhealthy egg, the embryo might not develop and implant in the uterus. So in such cases, miscarriage can happen when our body recognizes that the embryo or fetus has genetic or developmental abnormalities that would make it unlikely to survive. This recognition triggers a natural response, leading to the termination of the pregnancy. So our body's mechanisms is able to identify these abnormalities early in the pregnancy. I remember in the first few weeks of my pregnancy, I kind of felt like pulling feeling in my uterus, so I was worried, and I shared my concerns with my gynecologist, and I was worried that it was gonna be miscarriage. And she said, don't worry, your body knows if it's meant to happen, it will happen. At the time, I was flabbergasted by her response, but now I know what she meant. Of course, if there is like a cervical insufficiency, the topic that I covered recently, or other conditions, then yes, in such cases, miscarriage should be prevented. But I think we should also trust our body to do its job. Now, despite these considerations that I've just mentioned, many women are after the age of 35 or 40 have successful pregnancies and healthy babies. Firstly, advancements in healthcare nowadays ensure better prenatal care and monitoring, which allows doctors to closely observe and manage pregnancies. Many women also today are generally healthier, leading active lifestyles and maintaining good overall health and better informed, which can positively influence pregnancy outcomes. Also, with technological advancements in assisted reproductive techniques such as IVF and intrauterine insemination and other fertility treatments, we have increased chances of conception and a higher likelihood of healthy pregnancies. I also think that decision to start a family at an older age is of a conscious decision, which means we're all prepared emotionally, financially, and socially for the responsibilities of parenthood. Overall, age can pose certain challenges to pregnancy, but with proper medical care, healthy lifestyle, and advanced fertility treatments, we can still achieve successful and healthy pregnancies. So make sure to have proper prenatal care, including regular checkups and screenings to monitor both your and your baby's well-being throughout the whole pregnancy. And remember that your doctor is there to address any questions or concerns you may have. So do not hesitate to discuss anything on your mind with your doctor during your appointments. All right, that is it for today. Stay well, and I will see you next time.